Not everyone who snores has sleep apnea, and not everyone who has sleep apnea snores. Most people who have sleep apnea do snore. That's the most obvious sign that they come to us with, is they complain of snoring. And it is a symptom of that, is a sign of that, but they are sometimes exclusive. Well, some people who have sleep apnea don't snore. It has to do with the anatomy of their airway. The vibration from the soft palate is usually where the noise comes from and the snoring comes from. Some people's soft palate's very small. Some people's soft palate has already been surgically removed. Those patients may not snore, but yet they still have sleep apnea and have dangerously low oxygen levels, even though they're not noisy. And someone who snores loudly enough to be heard in another room should have a sleep test.